We've been talking about it for weeks now, the rising cases of cyclosporiasis across the nation. There are now thousands of cases confirmed or being investigated, and that includes dozens of infections in North Texas. In Michigan, where the largest number of cases have been reported, Taco Bell locations are moving some items from their menu. The fast food joint stopped adding lettuce, cilantro, onions, pico de gallo, and guacamole to its dishes, while federal and state investigators try to pinpoint the source of this illness. Now, joining us with tips to help fight this outbreak is Dr. Nikhil Biani, a fellow at the Infectious Diseases Society of America. He is also an infection prevention and epidemiologist, physician advisor for Texas Health Resources. Thanks for being with us this morning.
Good morning. Thank you.
Let's clarify, what is cyclosporiasis?
So cyclosporiasis, it's a parasite from the common foodborne pathogens that we're accustomed to hearing about, like your E. coli's or salmonellas. And the distinguishing feature about this is that when the spores of this parasite are released, they are not viable. They usually are viable at a temperature of between 72 degrees and 90 degrees Fahrenheit. So that's why you don't see a direct infection. That's why human-to-human transmission is not as common.
Okay, so symptoms, what are we talking about? Because they sound awful.
Definitely, the first and foremost is a watery diarrhea. You'll have fever, also low-grade fever. These symptoms can actually last up to anyways from days to several weeks, usually no more than 14 days. But those people who are immunocompromised, they definitely can have prolonged symptoms.
I was talking about this with my mom yesterday, who's visiting in town, and we had fresh fruit, we had lettuce on our hamburgers, and I thought, should we have done that? And that's, I think, what a lot of people are questioning right now. What can we do to protect ourselves? What should we eat, not eat? Where we stand with that?
So, definitely you want to be aware of, and good reason, like, for example, Taco Bell pulled some of their cilantro, pico de gallo off the shelves because a lot of these produces are important. We don't know what condition they have been, washed and treated. And definitely what is recommended if you go buy lettuce from home, lettuce from the store, just make sure you wash it thoroughly. Of course, it does not absolutely eliminate the risk, but it definitely does reduce the risk. Maybe avoiding buying prepackaged salads at this moment in time, and just taking extra time washing your produce, washing your hands, before you eat and after you use the restrooms.
You mentioned some of the different symptoms a moment ago, and let's talk specifically about, I have young children. My mother is staying with us right now. When we're looking at these sorts of age groups, when should you go, wow, I really need to take this more seriously? They need to go to the hospital. They need to be seen by someone.
Right. If the diarrhea definitely is extensive and, an individual's not able to handle the, foods or liquids, they definitely should go to the hospital in order to get IV fluids and to avoid any further injury to the body, namely the kidneys, from the dehydration due to the diarrhea, just because the frequency of bowel movements are quite increased.
Well, and from what I understand, once you get dehydrated and things start kind of going out of whack, you're in a really bad position.
That is true.
So what do you want people to take away when it comes to this parasite? How can we stop spreading it at this point?
Right. So one thing, we can protect ourselves and protect others, and just by offering advice, saying that number one, first and foremost, be aware of swimming around your community swimming pools, because this is usually a common source. Number two, also, when you purchase produce, spend an extra time at home washing this with water. Once again, it reduces the risk of cyclospora. And also, most importantly, wash your hands before you eat and after using the restrooms.
All right, doctor, thank you so very much. We hope this gets under control quickly. We appreciate it.
Thank you.